power of your smile is more important than you might think, even surprising researchers at the University of Utah Health when they found just how vital it is to recovering from drug abuse. Just ask Destiny Garcia, who went from being homeless to working in the front desk of the mayor's office.
Salt Lake County Mayor's Office is Destiny.
You would never know by looking at Destiny Garcia today.
I was a heroin addict, a meth addict. I was sleeping in a park when I got arrested.
That she was living on the streets as a drug addict not too long ago.
Oh, I felt like trash. I felt like I belonged down there. I didn't want to do that anymore. I did not want to do that anymore, but what else was I going to do?
Thanks to Operation Rio Grande, she was arrested and sent to treatment. And lucky for her, Professor Dr. Hansen, University of Utah Health School of Dentistry, was leading a study called FLOSS to integrate oral care with substance use disorder patients.
If you look at people who have drug abuse problems, about 50% of them have major oral health issues.
U of U dental students worked on several hundred clients going through drug treatment programs at the Odyssey House and First Step House, giving people like Destiny hope.
I had a smile.
Dr. Hansen, who also has an extensive background in drug abuse research, says the longer people stay in treatment, the greater success for patients not relapsing. After 3 years, researchers found clients were staying 2 times longer than those who did not receive dental care.
That was one thing that kept me there, was I was going to get new teeth.
There was an 80% increase in completing treatment.
It was a wow impact. Usually if you can get an improvement in treatment of like 10 or 15%, you think you've died and gone to heaven.
Dr. Hansen says they were working with the most difficult substance abuse clients in our community.
So now they can eat.
They found a positive impact on employment, sobriety, homelessness, all because of better teeth. Destiny went from not wanting to be seen,
Not having any teeth, it makes people judge you like you're still an addict,
to being the first person you see walking into the Salt Lake County Mayor's office and the last as you walk out.
Now I don't stop smiling.
And you don't have to. This was a first of its kind study and a win-win all around. Dental students have bonded with these patients and learning compassion for this population. Dr. Hansen's research has now turned into policy, convincing Utah lawmakers and lobbying to get Medicaid to continue a program similar to FLOSS, and it's called TAM.